You are watching Widefield with Vivian Birchall. This is Widefield.
Welcome to Widefield. I'm Vivian Kobusingye Birchall, your host. Today's special guest is Dr. Killian. Dr. Killian is a couple and family therapist and a professor who writes on resilience and self-care on his blog at Psychology Today called Intersections. Dr. Killian has over 70 publications on a variety of topics, including his book, Interracial Couples, Intimacy and Therapy from Columbia University Press. He can be reached at kkillian.org. Welcome to the show, Dr. Killian.
Good morning. How are you doing?
I'm great. This is unprecedented times, COVID-19, and a lot of families are going through unprecedented experiences. So please tell us about your work on resilience and self-care and why you believe it is increasingly relevant during this COVID-19 pandemic.
Well, I appreciate the opportunity to speak. When I asked you how you're doing this morning, I think that question has more and more relevance these days because folks want to finesse. They want to say, hey, I'm doing great. I'm doing fabulously under a global pandemic. But this is unprecedented in our lifetimes. We haven't encountered this kind of restricted movement, this kind of wondering whether or not, someone could catch it or a loved one might catch it. And so people are finding out that resilience, the concept of resilience is no longer so abstract and up here, that it's something that we're sort of having our own personal encounter with on a daily basis. And I think it's something that we can grow. I don't think people are just born more resilient than others. I think that it's something that we can, there are techniques and there are practices and there are sort of worldviews that contribute to an increase in resilience when we're under really sort of tough circumstances. So I don't know. I mean, I blog at Psychology Today and some of those are getting a lot of views. I think people are looking, they're hungry. They don't want to sort of drink in like sponges. Any sort of tips or suggestions we might have about how we all sort of can try to deal with the distress that comes with a pandemic.
And you see couples and families in your clinical practice.
Yes.
Can you tell us about couples and families who are doing well and a bit about those not doing so well during COVID-19?
Well, who does better? I guess people who are thinking and reflecting and are sort of asking themselves, what can I learn from this? For the first time ever, my life is actually slowing down a bit. And instead of being so darn busy, what can I get out of this time? And some folks who view this as a sort of a gift, and I know that might sound a little bit crazy, but to choose to view it and give it a positive connotation. Sort of in clinical terms, we talk about that being a positive, reframing. Mm-hmm. They tend to do a little bit better. Also, folks who've been through traumas before, mm-hmm. You would think that they would be sort of hooked or reactivated in a situation like this, but not so. A lot of folks who have gone through really tough experiences that have really, really had to survive, they're survivors of something, find that some of their skill sets that they learned to make it through before are coming in very handy now. So those are some of the folks that are doing better. They see this COVID-19 as an opportunity to reflect on themselves, reflect on their lives, learning how to tolerate uncertainty, figuring out ways to deal with anxiety, maybe explore a new hobby or resurrect an old one. I got a guitar back here and I promised myself I'm going to play it. It's been 3 weeks. I'm overdue. But but it's there. It's waiting. It's neglected in the corner, but it's waiting. So if people see this as sort of an opportunity, then they tend to do a little bit better rather than see everything as just being something out of their control and they're sort of a passenger in the car. Maybe not even a passenger. Some people feel like they're trapped in the trunk or the boot. And so the question is, can you sort of take the wheel and decide where you want this thing to go?
Right. I would have wanted to hear more about the couple element in that response.
We'll take it out in editing. Okay. So COVID-19, well, I thought, hey, not everybody's a couple in a couple or a family.
I know, but
that was for individuals. Yeah. I think COVID-19 can sort of act as a relationship accelerator. I'm not exactly, I don't know if you're into science fiction, sort of like a time machine, hitting sort of like hitting fast forward on your DVR, and it sends couples, further and faster into some potential future. If partners were living apart or in a long distance relationship, but now they're hunkered down and locked down together and during the pandemic, wow, it's like, welcome to the future. They're living together now, and they can see what works and what doesn't work for up close and personal. Circumstances kind of push them to experience life in close contact with one another in some circumstances. If partners often turn to each other for a lot of their needs to be met before Corona, can you imagine now? I mean, they're probably turning to each other for close to 100% of their needs if they're sort of in isolation or sheltering at home. That can be sort of overwhelming for some people, and it's important that partners make sure they're getting enough alone time to balance out all this extra bonus closeness. And so how can they do that? Well, partners probably should verbalize their need for personal time and space. And just like a partner might have had some transition time or a transition ritual sort of from one role, such as being at work, to coming home and arriving and going into home mode. Partners still need to switch, even if they're working from the house, they need to switch from a remote working mode to downtime at the house. So I would suggest, going for a walk or a jog, if it's permitted, if you're in an area where you can do that. Maybe listening to a favorite podcast, playing back ActonTV favorite episodes. Something to unwind and just be. I think that's really highly recommended, because now if we're really close together, it's harder to sort of, demarcate boundaries in space because we're sort of living on top of each other. So that's kind of important. If you're fortunate enough to have your own workspace like I do up here on the third floor, that's great. I cannot tell you how grateful I am to have my own office in the house. If absence makes the heart grow fonder, then being away from each other, even in the next room for a few hours a day, makes it easier for people to come back together and have fun later. Does that make sense? It
does, and it's very helpful because I can speak for myself. There's always the struggle to balance work and life and marriage and everything. So it's important to get some of these tips from professionals like yourself. And of course, which ties into my next question. Acton is home to many young families, and the current state guidelines and orders have tested our resilience as young families, including mine. What coping tips would you give us to create fun moments and memories amidst the chaos that comes with our disrupted schedules and lifestyles?
Well, I think one way, when I go on these 5-6 mile walks to the local communities and neighborhoods, I noticed that a lot of folks are doing sort of yard work and gardening. Yeah. And planting, and kids are putting signs up in the windows and also doing a lot of chalk artwork out on the sidewalks. And I think that gets people outdoors, fresh air, sunlight, and having an opportunity to sort of express themselves. And that's kind of key. I'm not an art therapist, but I could have been in another life. And I think people creative self-expression is very, very important for well-being. So that's one thing people are doing, although those can be somewhat individual activities. I know some folks are getting back to having meals together, preparing meals together. Some folks are playing some games with each other. I don't know. I've got teenagers and I keep hearing about social distancing. So that's harder for us to do. I mean, I think I first heard that between the siblings, the two brothers, they were in the kitchen and the older one unfortunately said, "Social distancing, don't talk to me." So your mileage may vary on this whole thing. I find that in my family, people are tending to kind of, be in their own spaces and going to their own rooms. But sometimes people will sit together and maybe watch a TV show together, with appropriate spacing on the couches and chairs. So there is time, and it's just a question of how people want to harness it or utilize it. Let's see, what are some other sort of thoughts? I know that families have been really making great use of Zoom, and they can get together. I think there's and also connecting through things like WhatsApp. So I've got a bunch of people. I was a dorm director at Syracuse back in the day, and I'm still in contact with a lot of folks from all over the world when I was director of the International Living Center. And so people are checking in on a regular basis on there, and they're in Spain, in Italy, and Hong Kong, and some place that's really far away, Jersey, and in Princeton. And we will check in with each other at Mexico, and just letting each other know we're alive, and a lot of humor, lots and lots of memes. But that's nice to sort of stay connected that way. One of my friends up in Toronto had 23 family members in a Zoom call. So that requires a little coordination, I would say. But she's definitely cut out to be able to do that. But she sent the invite out, and people chimed in, and that's one way to get the big virtual family reunion. And you know how everyone's doing all at once at the same time in real time. So that's some examples. I've explained how to use FaceTime to my mom. and we're doing it. We're actually seeing each other like 3 or 4 times a week now and talking, and that's good for her because she's in relative isolation in like a retirement community. And so, she's using Zoom too, though. She has board meetings and such, and she's checking in with people that way. But she also wants to hear from her family members. And so that's one way for her to do that, is actually see people and on a regular basis rather than just being kind of cooped up in a room. I mean, she's safer that way, but that brings up the whole question of physical distancing versus social distancing.
Right.
I think everyone should follow the recommendations and guidelines. I think that people should engage in social distancing, but I sort of want to differentiate the two. I think people can remain in social contact with each other and engage in physical distancing. But people really need to feel a sense of community right now. I mean, that is probably my biggest recommendation, is that people feel connected and in community. In a time where you can easily become lonely and separate.
That is true. And you recently wrote an article or published an article on social connections, right? If I remember correctly, I forget the title.
So, social support is often a key variable in the studies that I conduct. If people feel a sense of community, social support, they're more likely to have good outcomes, higher life satisfaction, greater sense of well-being. Social support is really key in people bouncing back from traumatic experiences, and experiencing something called post-traumatic growth, where you actually can have a sort of more compassionate, interconnected kind of stance on your life after going through something that was traumatic. But social support is key for those kinds of things happening.
It's interesting. Now that you mentioned social support, my next question ties into that. What tips would you give to our first responders and frontline health workers about coping with the stressful work that comes, stressful work that they're having to deal with? We recently read about a doctor in New York who committed suicide, and it's just been on my mind. Yesterday, I interviewed my guest who was a friend, and they have a lot of stress that they're dealing with. So what are some of the tips that you could give to that category of people?
I first of all, I want to say how much I appreciate all the commitment and the giving of self by first responders and doctors and nurses and EMTs and everybody that's in the front lines of this sort of epic struggle that the country faces, the world faces. I want to say something about professional self-care, but it just seems so small and compared to the incredible demand that this pandemic presents. But it's kind of true. We've got folks that when they get up and they get dressed and they get in their car, take a deep breath and think, okay, it's going to be okay. I'm going to go into work and I'm not going to catch this thing. And they go through the whole day with intubations and people being, desperately can't even breathe, and so many patients may pass. And then they say, okay, now I'm going to go home. And they're thinking, am I going to bring it home? My families. So to our families. So it's incredibly stressful. And what concerns me is that people will end up suffering in silence or separately from other folks, and they don't have that community, and they can't decompress and debrief and share. They've got to do that, because without that, they feel like they're alone with this and the enormity of it. And that's what scares me the most is folks may have used, for instance, a coping skill of not sharing the worst things that happened at work today with their families because of doctor-patient privilege, because, confidentiality, because they don't want to burden their friends and family members. But if they don't share just how painful and overwhelming this experience has been, again, they're on their own with this. And I don't think we're not designed that way, to be able to do everything just individualistically and handle things in our own way. I think we have to share, and we have to be connected, and we have to feel like there's people who will listen to us and who get it, that is, understand it, what we're going through. And so that I guess they'd have to choose fellow professionals and friends to share some of this burden with. Otherwise, it just becomes too much.
And there is a similar category, the families of the first responders and health workers, frontline workers, because those are another category, because they're worried about their loved ones, their family members, and they're having to deal with, I believe, what could be categorized as secondary trauma because of their loved ones' experiences.
Yeah, that's one of my areas, actually, secondary trauma. So in order for folks to bounce back from some of these experiences, in this case, we can talk about vicarious resilience, they got to feel like they're making a difference. They got to feel like they've got community support and family support. There's some key elements that help people move from just being secondarily traumatized. Well, in the case of medical workers, primarily traumatized, and then their families can be secondarily traumatized. And moving that into an area of vicarious resilience and feeling that they can up their self-care. And what's self-care? Self-care is not just, well, pack a bag and go to Bermuda. That's hard to do these days anyway. Self-care is about being grounded, engaging in meditative practice. Some people would say, well, just engaging in their prayer practice, something that gets them grounded and in touch with something larger than themselves and helps them to calm themselves. And so that's key to self-care. Being self-compassionate. I know that a lot of folks will feel really awful if they lose a patient, and they will just engage in self-flagellation and say, well, I wish I could have done more, and I failed this person, I failed their family. That kind of self-criticism and blame is just corrosive and very, very damaging. And if they have to get that out of the system, if that's one of their primary coping styles, I know folks like that how they handle things is by sort of blaming themselves or calling themselves up short or being kind of harsh with themselves. I listened to my sister work out one time, and some of the things she was saying to herself while she was working out were just horrible. Make your hair curl. Some folks are like that. They'll like sort of be critical of themselves. But I think that, again, can be non-productive. I think folks, once they get past that, have to be kind to themselves. And we're not perfect, and we can't make everything happen. I mean, it's just too much a high expectation. So self-compassion is an important consideration for frontline workers and first responders. It's just that the thinking you have to save everybody. You can try your best, but it's actually not possible. And so finding a way to grieve losses and express disappointment or feeling really, really down about someone passing, that's important. It's key. It's crucial.
Thank you. We really appreciate these tips, because it's not every day that someone gets that we get professionals, therapists, to give us some guidance on what could be done, and everyone is trying to figure things out. So thank you again. But before there's one other thing that I wanted you to talk to, which is you have written a lot of intercultural and interracial couple stories, or actually not stories, they are just different publications. Do you think this pandemic affects this category differently? And if so, why?
Well, I guess it depends what partners are in that particular intercultural or interracial couple in question. I mean, if an interracial couple has an Asian partner, then the other partner might want to check in with them and ask them if they've experienced any hostility, or has anybody expressed prejudice or hate to them? Is there anything they feel a need to protect themselves from? Turns out this week there was a survey that was done, and more than 30% of Americans have witnessed someone blaming Asian people for the coronavirus pandemic.
Wow.
This is a new Ipsos survey that was done in conjunction with the Center for Public Integrity and NBC News. 60% of Asian Americans, they make up about 6% of the population, told the survey that they've seen the same behavior. So I think what Asian Americans are describing is that at one time that they were sort of viewed as a model minority in the U.S., but right now they're getting dumped on again. Just like when there were wars in Asia, there's the Korean conflict and also the Vietnam War. There's this return to sort of this prejudicial treatment in public spaces again, and even hate crimes. So that is a real change in fortune, I guess, for Asian Americans right now. Also, African Americans disproportionately comprise deaths from COVID-19. There was a rumor circulating around, oh, African Americans don't have to worry about it because they can't catch this thing. This was just totally, not true. But then people like Idris Elba came out and said, you know what, you can get it, I got it. And so dispelled the rumor that African Americans somehow and people of African descent couldn't get it. But the statistics are really dramatic and disturbing. On the East Coast in Washington, D.C., African Americans make up 45% of the population there, but 75% of the deaths from COVID-19. In the Midwest, African Americans comprise 14% of the population in the great state of Michigan. That's where I'm from. But 46% of the deaths there. So, African American partners, and any partners really, should take great care and precautions if they have comorbidities, conditions like hypertension, diabetes, obesity, and asthma, in addition to just being, say, over 65 and some of the other things that are coming out. And I think what's kind of key is that we get good information, that we don't get too overwhelmed with watching too much of the news. COVID-19 at 3 o'clock, 4 o'clock, 5 o'clock, and 6 o'clock. That's all people are talking about in the news. But having good information from the CDC, good information from the World Health Organization is key to being informed and being able to know what is something to consider and to be careful about, and what is actually just nonsense and made up. So go to good sources and be careful out there and be safe and be well.
Once again, thank you for being my guest on Widefield. But before I let you go, do you have contact information that people can reach you at for additional advice and tips after this show?
Yeah, they can reach me through kkillian.org, as you said earlier. You can send me a message through that site. The main thing I tell folks is to maintain a routine. Structure is important. Get plenty of rest, and get up, shower, get dressed. Write down 3 things you're grateful for, and then pursue a manageable list of activities and tasks. And after that, blow everything off. You have permission to relax and enjoy your evenings and weekends and have as good time as possible.
Oh yeah, I love to dance, for example. So that's how I unwind.
Yeah, listen to music, and if you feel an urge to dance, please comply with that urge.
And any final word before we say goodbye?
Well, be well, Vivian, and it's great to see you.
Good to see you too. And for everyone else, thank you for watching Widefield. Till next time.